A wound culture and biopsy test identifies microorganisms causing infections in wounds. Doctors order this test when there are signs of infection. It's part of an overall health evaluation, including physical exams and other diagnostic tests like blood tests and x-rays. During a wound culture, the patient lies on their back. The wound is cleaned with an antiseptic solution. A sterile swab pre-dipped in antiseptic is inserted into the wound to collect a sample. This sample is then sent to a lab for testing. There are 3 main types of wound cultures: swab, stab, and pus cultures. Swab cultures involve rubbing a cotton swab in the wound. Stab cultures use a sterile needle to obtain a sample. Pus cultures involve swabbing pus from the wound. A wound biopsy involves removing a small piece of tissue from the wound. This sample helps determine the cause and type of infection. The procedure is done with biopsy forceps, and the wound is then closed with stitches or dressings. To prepare for a wound culture and biopsy, clean and sterilize the area. Remove any dead tissue, jewelry, bandages, or ointments. Clean the wound with soap and water. Wear loose clothing and avoid eating or drinking after midnight on the day of the procedure.